Women often walk out of the doctor's office feeling their symptoms weren't addressed, that it was all likely in their heads. Health magazine found several commonly misdiagnosed and untreated illnesses that you may need to speak up about at your next doctor's visit. Joining us is Health magazine's senior food and nutrition editor and registered dietitian, Frances Largeman-Roth. Frances, great to see you again.
Great to see you.
So this is a frustrating experience for so many women, to go to the doctor's office and emerge feeling that their symptoms were not addressed.
Right. They're told, you know what, go home and rest, get some more sleep, take it easy, and it's very frustrating. And for many women, they go for 4 years and through several doctors before getting a real diagnosis.
And we're going to talk about some diseases that this happens very frequently with. Is this because so many of these symptoms are rather vague?
They're vague, and they also sometimes look like other illnesses. So people go through several tests. So what we recommend is that you keep basically a diary of your symptoms and chronicle them as they go on, when they started, when it got worse, maybe what triggered symptoms, and that can really help your doctor make a diagnosis.
Great idea. All right, let's talk about polycystic ovary syndrome. Why is this often overlooked?
Well, it's very common. It actually affects 1 in 10 women, and it's the #1 cause of infertility. But, you know, the symptoms include acne and hair growth on the face, irregular periods, so it can look like other things like hypothyroidism.
So how is it generally diagnosed and treated?
Well, your doctor will do an ultrasound, look to see if you do have cysts on your ovaries, and also do a blood glucose test. And then it's treated with birth control pills and then metformin usually, which is an oral diabetes drug.
Can it affect a woman's fertility?
Absolutely. It's the #1 cause of infertility, and it also causes a lot of miscarriages.
Oh no. So is there something in particular a woman should be asking her doctor if she suspects that this may be her problem?
Well, again, coming in with your symptoms chronicled, you know, I haven't had my period for a year, I've noticed rapid weight gain, that's another real trigger.
Write it all down. All right, now what about fibromyalgia? Tell us what this is exactly and why this one is also sometimes overlooked.
This one causes chronic pain, but again, it's systemic, and it's not like going in and saying, you know, my knee hurts when I run. It's pain all over. But when you do go to talk to your doctor, if it's pain that has lasted for more than 3 months, that is a sure sign that you may have fibromyalgia.
And it's all over your body? All over your body,
and then your doctor will also do a tender point exam and press on certain points that don't have any redness or inflammation but still hurt to you. So, you know, just bumping into something will cause extreme pain for these people.
And how is it treated?
It's treated actually with antidepressants. I mean, you know, we've all seen these ads for Lyrica and Cymbalta. Those really can help.
That's interesting, because here's a case where, you know, you walk away and the doctor says it's in your head. And so that seems to suggest a connection.
Well, there's a body and a brain connection with this disease.
All right, now what about chronic fatigue syndrome? We've talked about that before, and it is, again, there are vague symptoms often, and it's difficult to diagnose, but I think doctors are getting better at it.
They're getting better. This is one of those that they used to really think it was all in your head, and it looks like other things like Lyme disease or mono, but again, this is fatigue that doesn't go away with rest. And, you know, something like going to the gym might knock somebody out for 3-4 days. And so people are actually, they're sort of working at a much lower level than the rest of us, and it can take them hours just to get dressed. So it is something that you really need to get help for, and corticosteroids can help, and over-the-counter pain relief can help.
So those are the major treatments?
Yes.
All right. It can be so debilitating, we know. Now, next up is lupus. Why is this one not so easy to diagnose?
Well, this is an autoimmune disorder, and it really makes your body its own worst enemy. It affects the blood, the joints, the skin. It's really systemic.
Oh, and is it painful as well?
It also does cause pain. So what your doctor will look for is 4 symptoms that go on. Basically, a skin rash that develops after you've been in the sun, mouth lesions that don't go away, and a low red blood cell count, as well as kidney disease.
But I can see how that would be difficult, because those can often signal other problems as well.
Exactly, and it affects women mostly, and it can also come on after you've had a baby.
Oh, it sounds terrible. Now, how is it treated?
It's treated with corticosteroids, and also a diet that's rich in omega-3 fatty acids fatty acids can lower the inflammation in the body, and so things like salmon, walnuts, and flax seeds are really beneficial to add on a daily basis.
All right, that's very good to know. Now, finally, multiple sclerosis. It's interesting that this one can be overlooked.
It really is, but again, it causes numbness and weakness in the limbs, so it could go on for months as just sort of a feeling of being fatigued. And for some people, it really is not debilitating, but for others, they need round the clock care. And so for this, you go in and your doctor will do an MRI, look to see if you have lesions in the myelin sheath, which is the protective covering for your nerves.
All right, Frances Largeman-Roth, thank you so much for all
Thank
this
you.
great information. And for the full article, visit Health Magazine online. And for advice on how to speak to your doctor, visit our health page at abcnews.com.